Welcome to the Intensive Care Nursery at the Children's Hospital at Dartmouth Hitchcock Medical Center. We understand this can be a difficult and overwhelming time for you and your family, and we want you to know that your child is in good hands with our specialized team who will provide the best care for your newborn.
Thank you.
We value the parent-child relationship, and we will work with you and your family to ensure that you are an active part of your child's care team.
Nobody plans to come to an intensive care nursery, and so we really try to welcome them the best we can.
We want you to feel informed about the environment that you're in. We want to teach you what things are as they come up, and we want you to feel like you know what's happening around you. This can also be incredibly overwhelming and information overload, and we want you to know that we understand that as nurses.
Sent overnight, and she's been 30% for me all morning.
All the nurses were so kind, and there was no question to me that they cared about the well-being of my child, and I trusted them deeply.
Have a similar oxygen level she's getting now, just a little less.
We all work together in the ICN. We work as a cohesive team, whether that be staff, and then also making sure families know that they are in the driver's seat as soon as they walk through those doors.
We understand that this is a stressful time for you as a new parent, and we strive to make the process as easy as possible for you. Our support staff will greet you at the front desk and guide you through the necessary protocols to ensure the safety of your baby and all the other babies in our care. This will include health screenings, removal of jewelry from the elbows down, silencing your phone, and cleaning your hands. Please note that it's all for the well-being of your precious little one and the other babies in our care. If your baby is brought to us by our transfer team before your arrival, we understand that it can be especially stressful. We aim to help you feel more comfortable by acquainting you with the unit, and we're here to address any inquiries or concerns that might arise. The unit consists of two main sections. The first is the critical care area, where your baby will be admitted. Following this, as your baby attains improved wellness, they will be transferred to the second area, known as the intermediate care area.
The nurses really try to do a great job of explaining what things mean and things not to worry about, but also that we're listening all the time to all those alarms and noises so they can just focus on their baby.
Close eye on his respiratory status today, coming off.
Our healthcare professionals are specially trained in the care of critically ill newborns. They will provide your baby with all the necessary care, closely monitor their vital signs, and ensure comfort. We welcome and encourage your involvement in your baby's care, provide support, and help you make informed decisions. Our staff will guide you on handling any equipment, and we encourage you to trust your parenting instincts and spend as much time with your baby as possible.
Are you going to tell him your story?
I want all families to know that they know their baby the best. So I always want them to know that they are a welcome presence.
I don't just consider the baby my patient, I also consider the family as within my group of care.
The family unit is not just what we see here at the bedside, that they may have siblings, they may have grandchildren, they may have grandparents, aunts and uncles that are all really, really trying to be involved in that baby's care.
We understand the importance of bonding and connection with your newborn, especially during their early development. We prioritize creating opportunities for skin-to-skin contact as soon as it is safe for your little one.
It's oftentimes an anxiety-provoking thing to have your baby in the ICN, but then if you can hold your baby skin to skin, you can just see the parents, it just feels so much better when they're holding their child skin to skin. And I think it helps heal the mom and dad and also helps heal the baby.
What do you see?
There's something about it that's just good for the soul, for the parents.
We went up there every single day to see Jennifer. And we would touch her, we would hold her. At the very beginning, they do something called kangarooing, and they'd put the baby right on you. And I do believe that Jennifer thrived so well because we were there every day, hugging, holding. We know babies react well by just that hugging.
I know.
While your baby is our patient, you also have to remember to take care of yourself, especially moms who are also recovering from delivering babies themselves.
Even if you just get in your car and go to Starbucks and feel like a person, take the shower, do your makeup, whatever makes you feel good, that's okay. It's good because you need to be good for them. And you need to feel like a whole person.
You've been doing great with her.
That's something we need to say to our parents more often. It's okay to not be here all the time.
There's a lot of families that have other children at home, and if your baby is admitted for many months, or sometimes mothers, they would like to go back to work and then take their maternity leave when their baby comes home.
You can always call for updates as well, 24/7, any time of day. We're here and we're ready to answer questions you might have.
You too. Lots of love.
Medical rounds are a great opportunity to have your questions answered and voice heard. They typically occur each morning and involve the healthcare team discussing the care plan at the infant's bedside. The team includes the attending physician, residents, nurses, and other specialists who may be involved in your baby's care.
That's a great time for parents to kind of hear the medical plan for the day, for the week, the long-term trajectory, to ask questions with the doctors.
Even if we didn't know what they were talking about, they would explain, this is what we're going to do. Here's a transfusion, for example. We don't want to do the transfusion. We want her body to produce the cells. If it doesn't happen, it gets to this level, this is what we would like to do. It isn't, this is what we're going to do, this is what we'd like to do, all with our permission. So we felt part of the team right from the beginning.
If you have a question, they're so willing to work with you and answer it. Even if it's something that you're like, I don't know if I'm comfortable with this, they'll either change that practice or tell you exactly why it is. And I think the whys are so important in those moments of unknown.
Rounds happens every day, and that's a good thing to know, so you can always write down questions and have them prepared.
We were able to work together and really collaborate for Estelle's care, and I think that was incredible for us.
Another resource available to families is David's House, a free home away from home. Our 20 comfortable bedrooms come in different sizes and configurations and are designed to accommodate families of all sizes. Guests have access to 2 fully equipped kitchens, home-cooked meals, laundry facilities, and wireless internet, all free of charge. It brings us great pleasure to provide our guests with round-the-clock, on-demand transportation between David's house and the hospital. Our staff is always happy to assist with any needs or questions during your stay. At Dartmouth Health Children's, we strive to create a supportive environment for you and your baby, where you feel informed and involved in your baby's care. We encourage you to spend as much time with your baby as possible while giving you the space and support to take care of yourself and immediate family. For more information about the intensive care nursery and additional family support services and facilities, please visit our website.